Hello, my name is Jennifer Benson, and this is my research proposal on diabetes. So, a quick overview of what we'll be talking about today. So, we're going to talk about the background of diabetes and why its research is so important. We'll touch on some ethical considerations for the research study I'm proposing. We'll go over some literature that currently exists, kind of reviewing the current base of knowledge, and then we will have a discussion about my findings. Diabetes mellitus is a chronic condition that causes the pancreas to decrease or stop its production of insulin due to insulin resistance in the cells. So if we take a look at this photo here, on the left you can see the pancreas. The pancreas is a organ that's responsible for production of insulin. And you can see that this pancreas is producing insulin, which are these little green dots here. And you see the insulin kind of grasping onto the glucose that's floating in the blood and more or less carrying it to the cells to move the glucose out of the bloodstream and into the cells. So we want the glucose out of the bloodstream because that's what raises the patient's blood sugar. This is a condition called hyperglycemia. Now, looking at the affected individual on the right hand side of this photo, you'll see the pancreas is producing the green insulin molecules. However, comparing it to the left side here, it's not nearly in the same quantity. So this causes the glucose molecules, so the glucose molecules are the little blue dots. It causes these glucose molecules to build up in excess, which is causing hyperglycemia. So basically, decreased insulin in the bloodstream causes abnormal blood glucose levels, which can have devastating effects if left untreated. This insulin resistance or decreased insulin production is known as type 2 diabetes. So, taking a look at glycemic control, or how well the patient is keeping their blood glucose levels in check, we need to discuss an important, reliable blood test that can indicate that information. So, hemoglobin A1C. Hemoglobin is a protein molecule in every one of our red blood cells. Glucose molecules, for a lack of a better word, cling or grasp onto these hemoglobin protein molecules. Red blood cells live for 2 to 3 months, so collecting a sample of blood and examining the amount of glucose molecules attached to hemoglobin will give us a better idea of how the individual is controlling their blood sugar over that time period. So after the explanation of diabetes and hemoglobin A1C, we know that we want the patient's number of glucose molecules to be low in the bloodstream, which means patients should strive to have a low hemoglobin A1C test result. So this chart here gives a visual of the expected A1C results. You can see that the higher the percentages is what is going to determine that diabetes mellitus diagnosis. And then, so prediabetes is kind of you're at a high risk for diabetes, and then normal down here is what a person without diabetes should have if they have a blood test checking their hemoglobin A1C. The goal of diabetes treatment is to keep the blood glucose at a normal level to prevent complications. This can be done through many different means. Two of the more popular methods I will be focusing on are lifestyle interventions, so things like exercise and diet, as well as oral hypoglycemic medication therapy. These are two effective methods to decrease hemoglobin A1C levels in diabetic patients, and they do so in different ways. So now we're going to talk about the purpose or the importance. Why do we need to study glucose levels and hemoglobin A1C levels? And why is managing blood glucose so important? Type 2 diabetes is a chronic condition that has a steadily increasing prevalence in Americans. Since the incidence of diabetes is increasing, we as nurses and other healthcare professionals should be able to provide the best evidence-based practice that is available. Uncontrolled diabetes, as you can see here, has serious debilitating effects on multiple body systems. So as you can see in the photo here, patients with diabetes are at a higher risk for cerebral vascular accidents, so the brain that's up in the top corner, coronary artery disease, which increases the risk for myocardial infarction or heart attack, and then also renal disease, so that's a very debilitating, and that disease has a very poor prognosis for patients as they get to the end stages there. So through studying how lifestyle intervention compares to oral hypoglycemic medication therapy, we can address the best way to reach glycemic control and prevent these complications in the over 30 million Americans who are currently diagnosed. That number is also expected to rise over future years. So the question that I'm proposing that we have a research study about is, in adult patients with type 2 diabetes mellitus, how does lifestyle change compare to oral hypoglycemic agents in reducing hemoglobin A1C over a 6-month period? Now we're going to go into some ethical considerations. So thinking about conducting a research study with human participants, ethical factors come into consideration. Researchers have a duty to protect research participants, and research participants have a right to decide whether they would like to participate or not. They also deserve to be fully informed of what the research study consists of. When dealing with medical conditions, researchers must attend to the ethical considerations of utilizing human subjects. Basic ethical principles have been identified and established to use in research, including respect for persons, beneficence, and justice. These 3 principles prompt researchers to provide quality and integrity in research, maintain patient confidentiality, and take steps to avoid participant harm. So the first ethical consideration we will discuss for this research study is beneficence, which means to do good. Type 2 diabetes has the potential to cause multiple serious complications when blood glucose is not controlled. Therefore, considering this ethical principle is exceptionally relevant. It's crucial to take preventative measures to prevent physical harm to the human participants in this research study. So since diabetes has insulin resistance present, hypoglycemia and hyperglycemia are both risks that researchers must take into consideration. So looking at the diagram on the right-hand side of the screen, we can see that these 2 abnormalities of glucose levels can cause serious symptoms. So hypoglycemia can result in even a coma, and that can happen fairly quickly if blood glucose levels are too low. And hyperglycemia, also if uncontrolled, it can have more devastating side effects towards the patient. But otherwise, we can see some of these over here: increased thirst, weakness, headache. So participants in this study must be monitored during the study by a medical professional to ensure that the researchers are doing good, which is the ethical principle here. So next, HIPAA. So HIPAA concerns are definitely something that have to be taken into consideration here. HIPAA is a set of laws that are in place to protect patient confidentiality in research. The privacy rule specifically addresses research. So patients have a right to remain confidential throughout the study, meaning that their protected health information cannot be released to the public without consent being obtained directly from that participant. So these are things like names, addresses, place of employment. They should always remain confidential. And then moving on to informed consent. So informed consent is the last point that we'll talk about as far as ethics go. Basically, all research participation is voluntary, so participants must be informed of all research that they will be a part of and make their own decision if they wish to participate or not. So, this would be the researchers grabbing the participants and having them sit down in a group or individually and explaining to them the process of the study, what it entails, the risks, and the benefits. There will also be an opportunity for participants to ask many questions, any questions that they may have about the study. Moving on to the literature review, management of type 2 diabetes mellitus with lifestyle changes and oral hypoglycemic medication has an existing knowledge base, so existing research about its effectiveness in decreasing A1C levels. In my review of literature, I reviewed 7 studies with time frames of the study ranging from 6 weeks to 106 weeks. So my proposed research is going to be a 6-week time frame. So the 106-week study that I spoke of there was they did quarterly reviews as well. So I kind of focused more on the information that was obtained through that first quarter there. So our first bullet point here is lifestyle change. The primary and preferred intervention for people with diabetes is lifestyle changes. According to Chen et al., which is in 2014, this can include walking as well as vigorous exercise such as running and cycling. So this research showed that structured exercise groups practicing aerobic exercise have been shown to decrease A1C levels by 0.59%, and that is a percentage that is considered clinically significant. This study had a significant dropout rate of 34 out of 274 participants. They withdrew prior to completion of the study. Another study that was conducted by Nadja Fitbor et al., which was in 2017, shows self-directed exercise reducing A1C as well. However, it was less effective than structured exercise. So basically there we found that structured exercise is more productive, most likely due to motivation by a therapist or a trainer. When exercise is combined with patient education and dietary changes, such as including fresh, unprocessed foods, there is an even greater reduction in A1C levels. Next, reviewing the literature on oral hypoglycemic medication therapy. So this is another option to manage diabetes. There are many classes of these medications, and all are effective in reducing A1C. Basically, the patient has to work with the physician discussing coexisting conditions and which medication is the best fit. In a 2017 study, Chaudhary et al. Researched the effect of various oral hypoglycemic agents on hemoglobin A1C levels. On average, there was a 0.5 to 1.5% reduction in hemoglobin A1C within the first 13 weeks of therapy. So this reduction is dependent on the drug class, which is why there's that full percentage point of a range. Munshi in 2019 further explained that glycemic control effects do not occur until 2 to 3 months after the initiation of drug therapy. So that's a pretty long time frame to keep your blood glucose level up so high. So similar to Chaudhary et al. In 2017, Munshi found a hemoglobin A1C decrease of 0.75 to 1.5% during therapy. At the 2 to 3 month mark, the hemoglobin A1C level decrease is considered clinically significant. So that was oral hypoglycemic medication therapy. Next, we're going to kind of compare the two and figure out some gaps of knowledge. So much of the research that has been recently conducted has focused on long-term effects of glycemic management options, so kind of more towards a greater period of time than 6 weeks. From reviewing the current knowledge base, we know that oral hypoglycemic medications have a greater statistical impact on hemoglobin A1C. And assessing the effect of both interventions, a decrease of 0.5 to 0.66% was related to lifestyle change, and a 0.5 to 1.5% in oral hypoglycemic medication. Although it should be mentioned that recommendations suggest that pharmacological treatment of type 2 diabetes mellitus, they suggest that it should be implemented after lifestyle interventions have not been effective. So kind of as a secondary option if the patient isn't able, for whatever reason, to keep up with their lifestyle interventions. Oral hypoglycemic agents also pose a higher risk of side effects such as hypoglycemia and organ damage. So there was another study that was done. However, it had a reasonably high dropout rate. So it kind of gives a good amount of information about these interventions or management techniques. However, it was questionable how reliable it was because there was that high dropout rate. Moving on, we're going to have a little discussion about the gaps of knowledge. So through reviewing literature, I've identified gaps in knowledge related to the extent of each of the variables' effectiveness. So there's a lack of knowledge of how these two variables influence adult patients in comparison to each other. Previous studies have utilized patient populations that have pre-existing conditions factored into the question, or they research patients who are already using oral hypoglycemic medications, and then they're studying the effects of beginning lifestyle intervention. So kind of focusing on patients that have pre-existing conditions such as hypertension, or they already have some form of renal disease. So just generally like not newly diagnosed patients. So I think it would definitely be beneficial to people with diabetes to establish the most effective treatment method to lower A1C levels. Conducting this research proposal and answering the clinical question to compare the effects of these two variables directly will provide healthcare providers with increased knowledge in initiating the treatment of adult patients with type 2 diabetes mellitus. Also, it will help guide nursing interventions and other patient cares for diabetic patients. By conducting a research study, we would be able to answer these questions, which would be really helpful in healthcare. So, how do lifestyle changes influence hemoglobin A1C levels? How do oral hypoglycemic medication influence hemoglobin A1C levels? And then, out of those two, what is the most effective method? So based on the current knowledge, this is kind of the framework that I've created for my research proposal. So group 1, this is the lifestyle change group. They will get their baseline A1C drawn prior to participation, and it will be recorded to compare it to their post-participation level. They will perform aerobic exercises led by a personal trainer, and they will also meet with a registered dietitian to help construct and manage an appropriate diet. So this would disclude processed foods and increase their fruit and vegetable intake. They will also follow these changes for 6 weeks, and then they'll have their A1C drawn again, and then that value will be compared to their baseline to see how effective that intervention was over the 6-week period. Moving on to group 2 here. So group 2 will also be an experimental group for the other variable, which is oral hypoglycemic medication therapy. So these participants will be assessed by a physician to determine an appropriate medication, so kind of identifying their risks and contradictions to certain meds. And then they'll have their A1C drawn prior to medication therapy initiation, and that'll determine their baseline level. And then they will continue their current lifestyle but only take that medication, and that will be for 6 weeks as well. After that 6-week time frame, they'll have their A1C drawn again to compare it to their baseline. to show how effective the oral hypoglycemic medication therapy is. And then group three here is the control group. These individuals will make no changes to their current activity levels or their diet. They won't be on any new medications. They'll just kind of be considered participants but not make any changes to their health. They will also have their baseline A1C drawn at the same time as group 1 and group 2, the experimental groups, and then they will also have another A1C drawn after the 6-week time period. So these are the references I used for the literature review, as well as just kind of putting together this PowerPoint. And thank you.